Hey guys, this is Dr. McGrath Medical. Had a few questions on the YouTube channel that we wanted to answer today. First one is, what makes for a high-grade finasteride? Technically, a generic finasteride is supposed to have the same amount of active ingredient according to the FDA. But we've seen with many other drugs, such as levothyroxine, which is a thyroid drug, where there are times a generic versus a brand name is not quite the same. Or even a compounded medication from a well-considered, well-reputable compounded pharmacy where they actually buy the product itself and they're using minimal binders and fillers, and there's no absorption issues there. We have found that we do believe that is a better option. But once again, generic is supposed to be just as good. Another one is it okay for me to shed while using finasteride for 2 months? You're always going to shed. It's part of the hair cycle. There's always going to be a time. Obviously, your hope is that after some time with finasteride, your shedding is going to reduce, but there's always going to be times of the year where you're shedding more than others, and that's never going to stop. So that's just part of the hair cycle. And then, what if I have a weak donor area? What are my options for transplant? This is a conversation that we have with our patients all the time. And it's another reason why we often are trying to help patients if transplant is something they're interested in, to begin some medication to see if we can get that donor area to get a little stronger. But there are always also there are limits. There are times where we'll have to say you're not a good candidate. The weak donor is not going to make for a good transplant. And then there are other patients who, a little weaker donor. So we explain, this hair is not going to make the impact that you're hoping for with a transplant. And if those expectations are understood, then sometimes that is a potential option. Then lastly, are there studies showing that transplanted hair cannot fall out? I'm sure there's tons of studies. It's very well established that the donor area that's used is DHT resistant, so much less likely to fall out in a transplant. There's a couple different things that can happen. Over time, you've got something like senile alopecia, where just, once you get in those upper decades, that hair starts to thin out and change. Sometimes medications can cause that hair to fall out. Obviously radiation, things like that. But overall, if we have good donor hair and we move that transplant, that hair is there for life. And that's why we feel that hair transplants are often a very good investment. And that's also why we always make sure to, let everybody know what they should expect and potential issues. All right, guys, hope that helps. If you have any more questions or anything, just, hit that like and give us some comments, and we'll be happy to answer some more questions. All right, have a good one.